Vitiligo. Vitiligo is a chronic autoimmune condition that causes patches of our skin to lose pigment or color due to destruction of melanocytes. Now, what is melanocyte? Melanocytes are situated in the basal layer of epidermis, or we can say that between the epidermis and the dermis. Melanocytes are skin cells that make melanin pigment. The more melanin you have, the more darker your complexion is. So, in vitiligo patients, the patient has a discoloration that is so white that it is evident there is no melanin. That means the melanocytes are being attacked or destroyed. The main causes of vitiligo are autoimmune, genetic, neurogenic, stress, ultraviolet radiations. Now, the types of vitiligo. It is divided into segmental and non-segmental. In segmental, it affects only on one area of the body, only on one side, without crossing the midline of the body on the front or back. Now, the non-segmental part. Non-segmental, it is divided into localized and generalized. Localized is again divided into focal and mucosal. In focal, macules are in a small area and do not spread in a certain pattern. In mucosal, it is usually seen in mucous membrane of mouth and genitals. Now, in generalized, there is bilateral vitiligo, acrofacial vitiligo, lip tip vitiligo, and vitiligo universalis. Bilateral vitiligo, for example, it occurs in both elbows or on both knee. It starts from one knee and it will go to the other knee. Same body part on both sides. In acrofacial vitiligo, vitiligo is seen in face, hands, and feet. In lip tip vitiligo, vitiligo is first seen on the tips of fingers, then on lips. In this case, early treatment is recommended as soon as the vitiligo appears in the tips of the fingers before it spread to the lip. In vitiligo universalis, the vitiligo is present all over the body. Vitiligo universalis is usually associated with Hashimoto's thyroiditis, diabetes mellitus, and pernicious anemia. Thing to note is that melanin is a pigment that protects our skin from UV radiation. Since there is absence of melanin in vitiligo patients on the white patch, so that area have to be taken care from harmful UV radiation by applying sun protection. Because in the absence of the melanin, the UV radiation may directly penetrate the skin and directly attack the DNA. Because usually the DNA and the nucleus is being protected from UV radiation by melanin pigment. In the absence of melanin, the UV radiation will directly penetrate the skin and enter the nuclei and will damage the DNA, which may cause serious skin conditions such as skin cancer. Management of vitiligo. In managing vitiligo, we may recommend patient to have high antioxidant food. For example, carrot and beetroot. Carrot juice or beetroot juice is very good in antioxidants. Antioxidant food help in reducing oxidative stress that helps in vitiligo patients. At the same time, carrot and beetroot contain beta carotene. We can also have capsicum like foods because it is very rich in color. Beta carotene helps in pigmentation. Low serum copper leads to reduced activity of enzyme tyrosinase, which is essential for the process of melanogenesis, that is, melanin pigment production. The patient may be asked to fill some water in a copper glass and have it next day early in the morning so that if there is a copper deficiency, it will supplement. What not to eat in vitiligo? Raw tomato, brinjal, due to its inflammatory properties. Red meats such as mutton and beef. Mango, pista, berries, tea, badam. These contain plant based phenol and tannin, which may attack the melanocytes.